TV Public Affairs presentation.
There are a lot of issues in our healthcare system, and now Minister Dix has the responsibility of addressing those challenges.
Good evening, welcome to Voice of BC. I'm Vaughn Palmer, and here, nearing the end of a political year in British Columbia, a very active one, we're happy to have on the show Cabinet Minister Adrian Dix. He only controls half of the provincial budget, not quite, but close. Thanks for being on the show.
It's great to be on the show. The legislature ended today, and
yes,
it's
it did.
Good to review things and talk a little bit about healthcare.
Yeah, and I think first of all, tell people, because something very unusual happened this afternoon, just after the House adjourned at 3, which is, I don't think we've ever had a cabinet meeting quite like it, and you were there. Tell people what it was all about.
Well, I can't tell people the details because cabinet is confidential, but people know generally what happened. We invited in 5 experts with various different points of view. People like to think how many were for and how many were against. They had a variety of points of view on the Site C project. And in the cabinet room with the full cabinet there, we heard from all of them. Heard from all of them for a limited period of time. I heard them exchange their views, and I think it was incredibly useful. The Premier, I think, felt that we needed to do that in addition to all the information we were receiving from the BCUC, from their report, all the information from the public in emails and briefs that we've received, and of course from BC Hydro and the Ministry of Energy, that this would be really useful, and it was. I think it's unprecedented, but I think it's a good precedent and something that I think will be useful to future cabinets on other issues.
Premier explained one unusual thing about it today at a press conference too. The experts took the oath of confidentiality that cabinet ministers take, and he said that didn't mean they couldn't come out and tell reporters afterward what they told the cabinet, but the confidentiality applies to them not repeating the questions they got, so that they don't come out and say, oh, well, you know, the Premier asked half dozen questions on this, or such and such a minister asked that. They're supposed to keep that confidential, the same way that all cabinet deliberations are kept confidential.
That's right. There are frequently officials in cabinet who give presentations, and their situation would be the same. The idea, the views of these individuals is not unknown. No. People know where the Pembina Institute is on climate change. Dr. Mark Jacquard participated in the BCUC hearings, and you can see his presentations on the public record, so you know what he thinks. David Austin, who's really an extraordinary thinker, a lawyer for interest before the BCUC for a long time, but also an extraordinarily public-minded person. Robert McCullough works for the essentially the farmers in the Peace Country. Yeah. So their views are well known, and you can go on the BCUC website in general and see the views and see their presentations. So we know they were saying, but seeing their interaction and having them present in one place was I think extremely useful to cabinet ministers. I know it was for me, even though I spent a fair amount of time looking at Site C in recent years.
The other thing the Premier said today, and I think just to give people a sense of what's still to come, was he said there will be additional briefings coming. He said the geotechnical concerns, issues, as we know, there's been some trouble up there with the banks of the river giving away and slowing the project. He said one other subject he said there would have to be a briefing on is the financial implications, the rate implications, and the province's credit rating. If you cancel the project, what does that do to the provincial debt? If you continue with it, what does that do? So there's still some things to come.
Yes.
I got the feeling a decision sometime between now and mid-December.
Well, the Premier said, I think, before the end of the year, so I won't go further than that. But I think what it shows is a little bit the seriousness and the maturity of the Premier. I think, and I'm impossibly biased, that he's done an extraordinary job. And there's the things that all of you see about his performance, the public performance, the confidence, the excellent presentation. I had no doubts. I've known Premier Horgan, John, for a very, very long time, right? So I knew he'd be outstanding at that. But I think what people don't see is the consistency of performance in the room, at cabinet meetings, at caucus meetings with the public. The performance has been exceptional this year, and I'm just, as a longtime friend and colleague, I'm just so proud of him.
Yeah. Well, I think, you know, I would say, and many others have said it, that whatever you think about the decision coming at the end of Site C, I think the thing has been very well handled. I think the Premier's approach to it and the way he's gone about it meticulously and methodically has been a good thing. And I hear what he's saying when he says it's a difficult decision, but to make a difficult decision this way, it might be an example for future governments as well.
I think so, and I think you see this in a lot of decisions. There's some criticism of the government that the opposition has expressed that we're doing too many reviews. This is a discussion. We're taking our time. But it's important to know on this issue why that's the case. I mean, if you just looked at the decision of the previous government to go ahead in 2013, things have changed, the demand forecasts didn't prove out, the BCUC said the project's more expensive than they said it was, et cetera. You could use that to criticize them, and we have to some degree. But at the end of the day, we also have to deal with the situation that British Columbians face. I mean, this is our Crown Corporation, BC Hydro, and we have to make a good decision for its future. We're dealing with some similar things in healthcare on information technology projects that are very delayed and have significant sunk costs. And so you have to make this very similar decisions, and you've got to, they're not as high profile in any way as Site C, but you've got to do the same thing, which is not just say, oh, the Liberals messed this up and look at what we have to do and prosecute the case against the Liberals. But you're now the government, and you have to deal with them seriously and maturely. And I think the Premier himself on a whole range of issues has set a good example for that. I think that's what people expect. And it's why I think he's doing extremely well right now, not just here in the legislature, but with the public as well.
Yeah. So I had two former health ministers on the show a couple of weeks ago. One of them a former BC Liberal health minister, George Abbott, and the other a former NDP health minister, Paul Ramsey. And you were in the middle of a decision right then, and they said that is the toughest thing to deal with as Minister of Health because it's so personal and so wrenching. You have to handle it in a methodical public policy way, but it's still very hard. And of course, this is the case where a family or a person's relative, there's a very expensive drug available to treat their condition. It's an enormous amount of money. It's not 100% clear how efficacious, how effective the drug is. But of course, if it's your relative, your child, brother, husband, spouse, you want it.
Of course.
And you had to deal with two of these just in the last couple of weeks. So, I mean, I sense give people an overview of how you approach it.
Well, first of all, we have a system of reviewing prescription drugs based on the evidence in Canada. And there's good reason for that. I am not a medical doctor. I'm not a scientist. Ministers of health shouldn't be deciding which drugs are effective and which drugs aren't effective, which drugs provide value and which drugs don't provide value. So what we've done in Canada is we've set up something nationally. All the provincial governments came together and set up something called the Common Drug Review. And it decides after a drug is approved for sale in Canada. So that's the first step.
It's made the safety test.
It's met the safety test. Whether those drugs should be recommended to be listed on provincial formularies. So they're listed in provincial drug plans. And the majority of drugs available in Canada are not listed on provincial drug plans. Right? So they go through that process and they have a recommendation whether to list or not to list the drug. And that's an independent process, independent of government, scientific program based on its clinical value. Exactly what you want, and the recommendation comes through. Then there's a provincial process as well, which takes the national process and applies it in BC, and also gives BC patients and patient groups an opportunity to speak, and there's a recommendation. So this week, there's a drug to go to the decision that the previous government took about a drug that deals with people living, was used by people living with cystic fibrosis. It's a drug called Orkambi. The Common Drug Review said, do not list. They appealed. It said, do not list again. They went to the Drug Benefit Council in BC. It said, do not list. And on March 13th, the previous government, the Liberal government, based on all of that evidence, made the decision, the only decision they could make, which was do not list. In this case, and it shows the difficulty of it, in the summer, a couple of young women, and there's others involved, many other people involved in this case, and lots of people in the cystic fibrosis community, had been receiving the drug through a private drug plan. And the private drug plan decided to withdraw coverage because the drug was so expensive. This drug, Orkambi, is $250,000 a year is the price. Right? So they obviously came back and said, well, we're going to lose access. It's very destabilizing and unfortunate and difficult for them because they believed the drug was helping them and they were being taken away. So there's been a movement around them. So in that case, what I did was I can't be overruling the science. But what the company said and what the cystic fibrosis community said to me in that case was, we're not allowed to present all our evidence because we need specialized trials to go back to the common drug review, new specific trials that had a specific criteria, and we can't meet that test, but we have evidence to go forward. So what I did was worked with other ministers of health and said, okay, we're not going to overrule that process, but we're going to allow you to go back and reapply and present all of your evidence, which I felt was the right approach. Now, the pressure from the drug company and obviously from people involved is they want you just to do it, to overrule it. The Minister of Health to intervene and overrule it. But in that case, I took specific measures to ensure that the rules were fair. And my plea and to Vertex, the company, is the same as when my Deputy Minister, Stephen Brown, talked to them in September, which is resubmit to the Common Drug Review. And it's been 2 months and they haven't resubmitted, but I'm hopeful they will. And then we'll be able to go through that process and see whether the evidence that they present justifies listing the drugs. And that's the way you do it. I think ensuring that the rules are fair, but not becoming scientist-in-chief when you're not qualified to be scientist-in-chief is the right approach, and that's what we've done. Just to put it in context as well, it's really expensive, right? I mean, the Americans spend 40% more per capita on prescription drugs. They have a highly politicized system. They passed a Medicare law a few years ago, a prescription drug bill, that stopped the Medicare program, which has $100 billion, that's billion with a B, in drug purchases, from negotiating with pharmaceutical industry on cost. Because that's the power of big pharma. We don't do that in Canada. The provinces have come together to negotiate. But you know, if we were to pay list price for drugs, then there would be vastly few people being covered. And a lot of the people whose coverage we need to expand because they have to pay pretty huge deductibles if you're earning $15,000 or $20,000 or $25,000 a year right now. If we want to expand coverage, we can't do it. In fact, we have to reduce it. So British Columbia, you have to do both. You have to have a fair system, especially in the case of rare diseases, because by definition, if you've got fewer people with a disease, the drug is going to be more expensive, so it has to be fair to them. But we also have to ensure that we can have broad coverage, because a lot of people don't buy prescription drugs because they can't afford it. It's not a question of the cost of the drugs, but they simply can't afford it. And so at every step, we have to ensure that the system is fair, so we have a public drug plan that's as good as possible.
And you're up against, of course, the other thing now, which is that you can go on the internet and discover that these drugs are incredibly effective, because there's all kinds of websites that will tell you that may or may not be vetted by scientists, or the way we vet drugs here in Canada.
Well, one of the great things that we've done, and we did it actually in our first budget, was reinstate funding to something called the Therapeutics Initiative, which is non-conflicted, so unpaid by the pharmaceutical industry, independent assessments of the value of prescription drugs. And it was started at UBC in the early 1990s. And interestingly, even though the previous government, the Liberal government, when they came in, spent years claiming they wanted to get rid of it. They never did, because ministers of health like George Abbott realized its value when they became ministers of health. Towards the end of the time, when Premier Clark became Premier, unfortunately the attacks on the Therapeutics Initiative became greater. And the pharmaceutical industry, of course, has always wanted to get rid of it. So we have in BC, people don't know this, some of the best independent health data in the world. We've had a PharmaNet system since 1993. The potential to make the right decisions is good, and to make the right decisions for public health care is very, very good here. And this has been damaged in recent years by something called the health firings case. Which
we will get to that.
We'll get to that. But it's also, I think, an extraordinary opportunity to deliver the best health care for everybody, and it helps us do it.
So we have some questions on tape for the minister, and let's start with a personal one from Bill Tillman. Here he is.
Minister Dix, you've been very open about your diabetes and the treatment that you require to stay healthy. Does that help you in dealing with health ministry issues, the fact that you have your own situation to deal with when looking at others?
I think it does. I think it helps me understand and empathize a little bit, because I take prescription drugs 4 times a day. I inject 4 different times of the day. I have insulin. I've had type 1 diabetes for a very long time. I actually, even though it's called juvenile onset diabetes, I actually came down with diabetes. Started suffering from diabetes when I worked for Glenn Clark in 1992. There's no connection between those two things. I want to be clear. But but interestingly, I was in the best shape of my life. I was preparing to run the marathon in Seattle in November of 1992. And I was working here in the legislature, and I was in fantastic shape. And I thought I was overtraining, right? Because your blood sugar, you know, the testing is supposed to be between 4 and 7. And when I finally went to the doctor, mine was 42, right? But it's also an example of good primary care. So what happened was I drove. I might have taken work with me. That's another story. But I drove to Royal Jubilee Hospital, and they stabilized me. And I went back the next week and got trained by a trained diabetic nurse for a day. And the training I got was really helpful. And I was able to, I've never been back to an emergency room, never been back to a hospital. And of course, I've been fortunate. It also tells you the other thing that everybody knows and should know, which is that the social determinants of health are important. Like, I am a very fortunate situation. I never go to the grocery store and don't buy a piece of fruit because it's too expensive. And because I have a good job and a supportive family and people that care for me, and I'm able to buy good food, it makes an absolute difference. I will live statistically much longer than someone, say, living on disability with the same disease. And so what it tells you is that we have to address not just healthcare in terms of surgeries and in terms of MRIs and in terms of doctors and nurses, but we have to address the social determinants of health. So I think that when we increase income assistance rates by $100, which is the first thing the government did, or increase disability rates by $100, or ensure that young people aging out of care can go to university or college or vocational training or go to school for free, that these are also healthcare measures in a sense. They allow, because everything we know about healthcare, everything we know about type 2 diabetes tells us that it's the social determinants of health that count.
Bruce Halser, this is, we're told, and if you watched the show a few weeks ago, you know this is one of the biggest issues the government's going to have to deal with next year, and it's not one that they even particularly went looking to deal with, but they can't avoid it. Question about it, Bruce Halser.
In mid-2018, marijuana will become legal in British Columbia for everybody who's an adult. I've heard many people say that there will be pressures on the health system as a result, and probably some positive and negative effects. Has your ministry looked into this? What can you say will be the positive and negative effects of marijuana legalization on health, and how is the ministry prepared to deal with it?
Well, we're obviously preparing for that in every branch of government, including the Ministry of Health, as is the Federal Ministry of Health. We talked about it a little bit at the Federal Provincial Health Ministers Conference I was at. I don't know if there's positive or negative, it just is. The federal government has decided to legalize. There's a whole bunch of administrative issues that Mike Farnworth is dealing with, and there will be, I think, consequences for public health. It should be said that a lot of people use marijuana in British Columbia today. So there's a question as to whether we'll see an increase in usage, but we have to be very conscious of that, and on all issues of addictions, which are central to the whole view of the government right now. I should say, though, that our focus, well, we have people working on that, and we're preparing for that, preparing for its impact. Obviously, the focus of the new Minister of Mental Health and Addictions, Judy Darcy, is on the opioid crisis right now, and on issues, broader issues of addiction, which are, as you know, this year have killed on average 145 people a month, which is an enormous increase, and that presents a challenge for us as a society. And so I'm very proud of the work Judy's doing. It's very challenging, and I think she and the health authorities are doing an exceptional job. And I think one of the most important things I've done as a minister is not the stuff that I've been doing directly, but the support that the whole health system has been giving to Judy in her efforts. There's always people who say, well, if you divide things up, there'll be turf wars. Well, we haven't seen that. We've seen quite the opposite. We've seen a real coming together, and we have now someone who advocates, who thinks about those issues every day. And when you think of all the other issues in healthcare, I'm very proud of Judy's work, and I think it was an excellent decision by the Premier to do that. We've done versions of that in the past, ministers of state for mental health and other things, but having a full ministry and a full seat and someone really focused on that has made a huge difference.
Be one of the ministers we hope to have on the show in the new year. When we come back, there's a lot of new ministers that it would be good to have on. We have the health minister tonight. Stay with us. We'll take a brief break on Voice BC. We'll be right back.
The government of BC, for lots of good reasons, through the WCB, through ICBC, and through other agencies, sometimes refers patients to private clinics because they can get procedures done faster at less cost ultimately to the taxpayer. The NDP has a choice. It can accept what other governments have accepted and save the taxpayers money, or it can choose to be ideological and try and shut down these clinics.
My name is Irene Lansinger, and I'm the president of the BC Federation of Labour, and I love politics. My work is politics, my play is politics, I'm about politics all the time, and that's what Voice of BC is about. So come back to hear some more politics.
Are you worried about getting diabetes?
I'm a millennial.
Well, sorry, but 1 in 3 Canadians has diabetes or pre-diabetes.
Really?
The Canadian Diabetes Association, with support from Sun Life Financial, urges all Canadians to take the test.
There are more ways to connect with us at Voice of BC. Email us at vobc@shaw.ca. Follow us on Twitter at Voice of BC. Or like us on Facebook at facebook.com/VOBC on Shaw TV.
Four years ago, Adrian Dix was leader of the NDP in the loss to the provincial Liberals that was not expected. Today, he's the Minister of Health, one of the most powerful ministers in the cabinet, in charge of one of the most important ministries. It goes to show that consistency and sticking with it in politics does pay off.
Welcome back to Voice of BC, and we're going to go straight back to questions on tape because we've got one from the Business Council. Jock Finlayson here. Jock.
Minister of the Commonwealth Fund, a well-respected nonpartisan research group, has just issued their updated report on health system performance across about a dozen advanced economies. Canada once again comes in near the very bottom. We actually rank dead last on access to both primary care and specialist services, and we have the worst waiting lists of any affluent country. In light of these troubling results, does it still make sense for Canadians, including BC residents, to have confidence that they will be able to find decent health care when they need it?
Minister?
I think that's, of course, the challenge. I think it should be said that Canada, and people don't often understand this, has kind of a unique healthcare system.
Yes.
It's a public insurance system, but unlike many other jurisdictions, the UK and other, much more private delivery. This has been the historic compromise of Canadian public health care. So most of your primary care doctor's office are privately delivered. So I think the short answer to Jock is that there's some improvements that we have to make. Of course there is. Our system does very well in many respects in BC, partly because our people are healthier. We smoke less, we drink less, we exercise more. These are all important things that help us get good results overall in comparison to other countries. But there's some steps we have to take to bring the healthcare system forward, the public healthcare system forward. And most of the solutions, I think, are in the public realm. We have to improve the way that we do surgeries, and some of the innovations that have happened even in the last 10 years have to be duplicated and advanced. We have to, I think, bring the notion of team-based care into primary health care, and so that the best of doctors and nurse practitioners and nurses and dietitians and pharmacists can work together. We've tended to be siloed in our healthcare system, partly because of the predominance of the fee-for-service system, and so we have to make changes, and they can't be made because I declare that they be made. We have to make them working with doctors, and I think we can do that. We can improve the quality of care by moving to team-based care. I think the 20th century was, in some ways, in Canadian healthcare, the era of individuals performing care. We have to work as teams better and to provide care all over. And so that's what I'm determined to do. I think the Canadian healthcare system, that's one report. There are other reports that have somewhat different conclusions, I would say, with great respect. But we've got to do a better job at reducing wait times, which went up in the last few years, at providing better seniors care. We have As you know, 90% of care homes not meeting standards in BC. That's not good enough, and we have to address that. And my focus over the last few months, working with our whole team in the Ministry of Health, is working with doctors of BC, with groups, with community health centers, with others, to improve the quality of primary care. Because ultimately, you can't build enough hospitals to respond, and you don't need just to build hospitals, although we need to do some of that. You need to have better care in the community so that people, when they leave hospital, have the supports they need to stay well and they can live better.
Bill Tillman with another question. This is one that has haunted many a provincial government since I started doing this 35 years ago, and it is, what about Ottawa's piece of the action? Here's Bill.
Minister, under the Stephen Harper and then Justin Trudeau governments, we've seen a significant reduction in transfers to the provinces for healthcare. How do you as minister deal with those reductions on top of having the ministry which is probably under the most cost pressures of all?
It's supposed to be like 50-50 when the whole thing got set up, wasn't it?
Yeah, and what we
about, what, 25?
It
now?
really fundamentally changed in the 1990s.
Yeah.
And you know, there's a debate about this. A lot of people credit Paul Martin for reducing the federal deficit at the time, which he did, but he did it largely on the backs of the provinces, so it was easier for the federal government. So, and BC really got the worst of that. So what had happened at the end of the 1990s was that BC had defended healthcare more than any other jurisdiction. And you could see that in both the amount we spent and the levels of care and our #1 performance in Canada at the end of the period the NDP was in office. But people hadn't seen the improvements because essentially we were back filling federal cuts. Between 2004 and 2014, there was a health accord deal, roughly, in that period, where that changed. In fact, what happened in BC in that time was that the federal transfers started increasing 6% a year, which is above the rate of inflation for that period. But what the provincial government started doing, of course, was essentially cutting the provincial share. So they missed an opportunity. I think they missed a fundamental opportunity from 2004 to 2014 to make the primary care reforms that were necessary. In the most recent period, the most recent things that under Stephen Harper and then under Prime Minister Trudeau, we've done quite a bit worse than that. So now we have to engage in those reforms in a little bit more difficult period. But I think it's still possible. I think there's support from the federal government to do things, and I don't think it's really useful to focus on that issue, on fighting with the federal government. There's one issue that really hurts BC, which is that they tend not to consider the demographics of the population. So we have a lot of people moving here, especially seniors, and we consume, if that's the right word, healthcare services more as seniors than at other times in our lives, are moving to BC, and we get no credit for that, which means that we lose ground. And that was a change that Prime Minister Harper brought. And to be fair, I remember the Health Minister, Terry Lake, complaining quite bitterly about that at the time. So these are the things we're dealing with. But we have to, this is the situation we have. And while I could spend a long, eloquent soliloquy, which I sometimes do, criticizing the federal government, I think it's more useful to just get on with things. That's what people expect us to do.
Well, the next question is one of those ones that people ask, and you'll hear people ask this all the time. You don't hear people running the system asking this very often, but I thought, well, it's worth letting somebody say it. So here's Dr. Ian Cordes with something that all kinds of people out here say after they get here. Here's Ian.
Many people pay their taxes in other jurisdictions. Healthcare is mainly provided by provincial tax dollars. The federal government now is probably only contributing certainly less than 20 cents on the healthcare dollar. And so I think it would be in the interest of BC politicians to figure out a way that we can get those that are moving here to pay more relative to a British Columbian that's paid tax here all their lives. And I know this is not a simple thing, but I think somebody has to start thinking about that in this province, because the demographics are insurmountable if we keep bringing people in over 60, and the number of people working and paying the taxes to support those people is not growing at the same rate. We've got a major problem.
Well,
Essentially he's saying what we were just talking about,
Yeah,
which is that federal transfers should reflect the composition of the population. They should respond to that, and we should get more money from the federal government for that. And we have in the past, and we don't now. We're going to continue to make that case, understanding that other jurisdictions that benefit from that arrangement, Alberta, Quebec, other provinces who benefit from the current formula are going to fight that for their own reasons, right? Yeah. And so the reality is, and I say this with great respect, it's one country. And we have huge advantages in the freedom of movement around the country. Yeah. Huge advantage to goods and services and people. Yeah. This is a huge advantage to us. The idea that we would put roadblocks, for example, in people coming here to work in our high-tech industry from other parts of the country, I don't think that would make sense. That we would put roadblocks when people come here to work in other industries or support their families or spend their dollars. Yeah. It wouldn't make sense. So yes, it's true that it puts significant pressure on British Columbia's healthcare system to be part of Canada. But I like being part of Canada, and I think we should stay.
Yeah. Bruce Halser. With something that, and now when you were a guest on this show and an opposition health critic, this came up. So now you're in government. Bruce is going to see where you stand on this now. Here he is.
The NDP has long opposed the expansion of private clinics in our medical system. Now that you're in government, you're responsible for the fact that the Workers' Compensation Board and ICBC and some other government institutions refer patients to private clinics so that they can get procedures done quickly and they don't have to wait as they would in the public system. Are you going to end that practice, or do you accept that there's some role for private clinics relieving pressure on the public medical system?
Well, it's interesting because I think I said this earlier, that we have a significant amount of private delivery of healthcare, and we always have. I mean, our primary care system, most doctors, long-term doctors, are small business people, and so their bills are paid, but they're essentially private business people as well. And that's one of the things that young doctors are concerned about. They don't want to do that. They want to practice medicine. And so that's also an opportunity for us. There's lots of talk about that. So on the private clinic question, of course, I believe that people shouldn't pay to get preferential access to care. And that issue is being litigated in the courts and has been, these last 8 years. Because the provincial government was sued by Dr. Brian Day, and I say with great respect, partly because he and others didn't want the law enforced in British Columbia, and so we have to enforce those laws because those are the fundamental laws of Medicare. With respect to the efficiencies of the system, the public system, I say I disagree with Bruce Halser in most cases, is significantly more efficient than the private system. So it's not an ideological approach, it's just a practical fact that in hospital care, in all kinds of other forms of care, I can tell you the public system is more efficient than private clinics. We have some existing contracts today and that some public health authorities have with private clinics. Again, paying public pay even for private delivery. There's some serious questions as to the efficiency of those things, but we're not going to be going around breaking contracts when we have them for surgeries. So for surgeries or other services, that's not going to be our pattern. But our emphasis is to make the public system more efficient and to ensure that there's sufficient operating room space to reduce wait times, which climbed again and again and again under the previous government.
Adrian Lanzinger, BC Federation of Labour, with a problem that rattled around again in the system off and on for, well, I would guess most of the time the Liberals were in office. Here's Irene.
Minister Dix, one of our priorities should be quality care for seniors. Yet under the Liberals, there was significant privatization in seniors' care home and contract flipping that resulted in inconsistency in staffing and difficulty in providing good care for seniors. What is your government going to do to stop the practice of contract flipping in seniors' care homes?
I agree. It was overall very negative. And you see the consequences now, right, which are, I think, pretty significant. We have an effort right now, a proposal that the previous government put forward right at the end of its mandate. They didn't fund it. They put forward a press release saying that we were going to go to 3.36 hours of care per day, per patient day. per resident day. And it's an important proposal, right? Because right now, 90% of care homes, according to the Seniors Advocate, don't meet standard, which is, if your parent or your friend or whatever is in a care home, is a significant issue. Here's the challenge. The first is financial. We're going to have to find the money, right? And the Liberal government didn't really deliver any money, so we've got to find the money to do that. But secondly, we have to find the people. If you think of that, that is 1,500 more people to meet that standard. 900 of them care aides. So here's the problem. The majority of care aides in British Columbia care homes are part-time, which means they have very inconsistent work, frequently more than one job at a different care home. So we've devalued the work, and the Liberals did with Bill 29, and they continued to do it after that. Secondly, we have a high level of injury. Any WorkSafe report will tell you that these are very difficult jobs, a lot of injuries. But if you have someone in a care home, really important job. And 25% of care aides are over 55. So we've created a situation where the previous government devalued this area of care, attacked them systematically under the law, and now we need to hire way, way more. When you think of that, we have to really work hard just to maintain our present levels, and we've got to do better than that. We've got to have 1,500 net new people, 900 net new care aides to meet the minimum standards, and that's a commitment that the previous government made and didn't fund, and a commitment that we're making, and I'm in my mandate letter going to try and find the money to. So it's not just an issue. People have looked at this as a labor management issue, the instability. But when you have constant contract flipping, which is essentially forced on the system by the government, then it's very, very hard to recruit people. And the government, this is one level of ambition I have to meet that test, and it's going to be a major challenge, and I'm going to be working with the care providers and the HEU and the BCGU and everyone to meet that challenge. That's there on the one hand. But on the other hand, as you know, in the labor market, we're also moving forward with a child care program, which is going to be significant, but which is also going to require significant new labor resources. So we have to ensure that this work is valued and the workers are valued, and they haven't been. And that's why I disagree with contract flipping, and we're working on solutions to that.
You mentioned this earlier. We've got a whole question on it, and it's a good one. From the Tyee, Andrew McLeod. He followed this story as closely as anyone, and we'll see whether we can have closure on it now. Here's Andrew.
As the health ministry critic when you were in opposition, you were a champion for the people who were fired in 2012. Now that you're minister, I'm wondering if there are still things happening there to make that situation right. I know there was a process going on inside the ministry, sort of a reconciliation thing, and the ombudsperson's report is still being put in place. I'm wondering what you hope will come of all of that.
One of the first things you did, you should tell people if they didn't know this, you appointed one of the fired healthcare workers to the board of the Regional Health Authority.
That's right. Ron Matson, who's really a remarkable guy, a longtime employee of the Ministry of Health, very experienced in healthcare matters, and also a city councillor in View Royal, which is a community around Victoria, so understands communities and the communities around Vancouver Island. I appointed him to the Island Health Board, and I think he's an excellent appointment, and it obviously sent a message as well, a little bit of a message, but he's doing an outstanding job, and he's a terrific guy. Andrew's right. There's a lot of recommendations of the Ombudsperson's report to be implemented. Mr. Justice Cromwell has been assigned to ensure that those recommendations are put in place, and in fact I'll be meeting with him soon to discuss some of our role. And so there's a series of things to do. There's a series of measures to bring justice for the people affected, and those are being implemented, and you see in the regular reports from Justice Cromwell that that's happening. There's also things we have to do in health research to fill the gaps that were started by the health firings scandal, if we may say. The government cut off access to data for groups such as the Therapeutics Initiative. We reinstated funding and are addressing those questions of access to data for health research and the research capacity of the Ministry of Health. We've got to refill those gaps because essentially they decimated the research capacity of the Ministry of Health, just as we have to make very significant decisions about the future of healthcare. And so one of my roles and one of my tasks as Minister of Health is to rebuild that. It's one of the recommendations of the Ombudsperson person's report. And I'm working with lots of people, including some of the people who are fired health workers, but many others in the ministry and outside who are very committed to that idea that the Ministry of Health should be the center of independent, non-conflicted health information and health research that brings the best possible spending of health dollars, but also the best health for all British Columbians.
It's not quite a happy ending because, of course, one poor man killed himself, and a lot of people were put through the mill. But there's an aspect of it that at least things have been made better.
And in the case of Roderick McIsaac, and his circumstances are extraordinary, and we've talked about this in previous shows. But he was a co-op student in the Ministry of Health, and unbelievably, he had 3 days left in his co-op tenure. And they suspended him. And then after his tenure was over, they fired him. And of course, it became a very significant public issue. And he was a very thoughtful guy. He had delayed his PhD to take care of his mother. And so he had started in that. So he was in his 40s and doing his PhD, so he was anxious. And this was devastating to his academic career and totally unnecessary, totally capricious, totally nasty. And I think the conclusion on the government side, and the thing I'm most critical of, you can all the things about it you want, but at every turn when they could have done the right thing, the just thing, they either the politicians or the senior public servants in the cases chose the government interests, their sort of private interests, the government's interests over the opportunity to justice. In the end, of course, those were the wrong decisions even for them.
We have some other healthcare issues to talk about on the show, but we're also going to come back for book chat. Stay with us.
We also need flexibility in union contracts that do allow us to pay differentially to get people to work in the areas of the province that are in short supply, and that now includes downtown areas. So I think we've come up with solutions in the past based on catastrophes when rural areas were unable to attract physicians or nurses, and we've come up with solutions. So I think we need to come up with similar solutions to deal with the shortages in the larger urban areas, particularly the areas where cost of living is very high.
Hello there, I'm Dr. Perry Kendall. This is Voice of BC.
He fell. Whoa, I'm not driving. I'm way too stoned. How are you feeling, Veer?
Oh, since we had that talk, I'm not driving tonight at all.
What about you, Dave?
You only had a couple of drinks.
And only a couple of puffs.
I don't drink and drive. No way I'm getting behind the wheel when I smoked weed, too.
How are we getting home, then?
Well, you can drive, Dave.
Come on, Dave.
Take one for the team, buddy.
Don't let weed and alcohol influence your decision to drive.
Yeah, I need a ride.
Now, I don't want to get in trouble with Darryl Pleckus, but I'd like to give a nickname to Adrian Dix. I think that when all heck is breaking out in the legislature, when certain cabinet ministers are underperforming, I think Premier John Horgan looks over at Adrian Dix and smiles and thinks, everything's going to be okay. He knows what he's doing. And for that, I think Adrian Dix is the Minister of Comfort.
It is Christmas time. It's the Christmas season.
That was really kind.
Yeah, it really is. He was wearing a Santa suit when he did this. For
is that right?
That was. But he just handed out a treat. So,
there it is. I'll take it.
So you're a major reader.
Yes.
It tends to be one of my major vices is reading. I don't consider it a vice. So we're going to do a little book chat here, and we even have a little video to introduce it, I believe. Do we not? Let's see. Yeah, there we go. Okay, so we're going to talk about books, and he's the health minister, right? So he puts a real page-turner at the top of the list. Better now, tell us about it.
So Dr. Danielle Martin, you might have seen this. She was a Canadian doctor who went and testified before a U.S. committee. So in there, she promotes 6 big ideas for healthcare. something that's familiar to me on primary care, ensuring that everyone has an attachment to a family practice doctor. Other ideas about data, about a national prescription drug plan. So there's 6 big ideas in her book, and it's quite engaging. She's quite an engaging person, and she had quite an impact on the U.S. health debate when she was there. So it's a book that's available, I think, at most local bookstores, and is actually worth a read.
Oh, that's good. Number 2. Okay. This one looks really interesting.
It is.
Okay.
And he's actually, quite frequently, Gilbert Welsh is on U.S. television. One of these doctors who does a lot of television talking about health matters. His argument is that we overdiagnose. That, just give you an example about diabetes. There was a very important trial that happened with thousands of people in the United States in the 2000s. And what it showed, there's 2 things. One, intensive care therapy for diabetes, and the normal. And they actually, I believe, interrupted the study, because the people taking the intensive care, who were getting more care and more intensive care, were actually dying more than the people who were getting less. Why is that? Because in diabetes, you're balancing your blood sugars, but part of it being intensive and ensuring your blood sugar is right where it should be, is that sometimes it drops low. And so people maybe are more vulnerable there. What it shows is that sometimes when we get overdiagnosed, when we overtreat, when we intervene when we don't need to intervene, it drives costs in the healthcare system, of course, but it also can affect our health negatively. He's not suggesting you shouldn't go to a doctor or anything else, but he is showing in very stark terms how sometimes overdiagnosis is driving anxiety and cost and can be damaging to your health if it's not done in a wise way.
Okay, number 3 on the list is, we picked a couple of books that had a connection to this show. So The Mighty Hughes, this is about Ted Hughes, who was one of the great watchdogs in the whole history of this country, a commissioner nationally, conflict commissioner provincially. Book's written by a friend of mine who was the Vancouver Sun's Victoria Bureau Chief, Craig McInnes, for many years, and it's a really good story because it goes back to his time in Saskatchewan and tells all of that and all of his time in British Columbia. But it's also, and the line I've used on it is, we used to say when Ted was handing down these great judgments here that if he didn't exist, you'd have to invent him. Yeah. But this is really about how Ted Hughes invented himself through facing very difficult decisions and applying integrity and good judgment to them. Yeah. He built his reputation decision by decision. He made some mistakes. The book discusses it, but it's a very impressive book about a great BC citizen.
And extra, just in the one way, part of the problem is, for us, is in some ways we've been connected to some of those events. I mean, the one I think of most significantly, I'd just become an MLA, and I was working on child protection issues. I was the children and families critic for the opposition, and we were really giving the government a very hard time, but there had been serious cuts made to the children and family system. And Stan Hagen, the late Stan Hagen, appointed Ted Hughes to be the special commissioner. And what came out of that was that Ted Hughes concluded that the government had underfunded the system, contrary to what they've been saying, and that had a significant impact on them and forced a response. And he also created the new child representative position, which was originally taken up by Mary Ellen Turpel-Lafont, of course, and that made a huge difference. The government of the day had taken away the independent child commissioner, and he had the force, I think, the moral and political force to take that debate that was happening in the political realm and establish a child representative who could see all the evidence. Because one of the problems that Ted understood about that, I think, is that the very privacy afforded to children protects government when they're neglecting children, right? Yeah. And this is a very difficult problem. So this response was extraordinary. It's only a small chapter in the book, but it's a remarkable achievement. I think the child representative will be in British Columbia for a very, very long time, and the changes that were brought about as a result of that have been extremely positive. And a lot of people had a small part to play in it, but I think Ted Hughes's role was to sort of bring all that together and to set people down a path that there was a consensus on. And in fact, after that, the issues for quite a bit of time became less a subject of political debate, but a lot of work was done, and he set, I think, British Columbia on a good path, and for that alone deserves enormous credit. And of course, that's just one chapter. That's just one chapter of 20 in the book, right?
One chapter in the book, yeah, and that the senior describing the press conference where he produces this report, and the first question from Dirk Meisner, the Canadian Press, is, but Mr. Hughes, the Premier says that budget cuts had nothing to do with this, and the sentence is barely finished, and Ted says, well, he was wrong. And it was like, I remember reporters who'd never covered him before coming up to me afterward and saying, he's just like you said he is. Yeah. He's fearless, right? Yeah. It's what a watchdog is there for. And it really is a very interesting book on how to be one in a way, by making yourself into this person that speaks truth to power.
But you also have to do the work, right?
Oh, yeah.
You have to do the work. Yeah. And I think, I mean, at the time, if I recall correctly, he was doing work on another commission in Saskatchewan and doing this.
Yes.
And so that's doing the work, right? And I really admire and respect that. There's got to be a book about his wife Helen, but that's a different story.
I agree.
For people who are interested in Victoria life, they know
they're trying
about Helen Hughes.
There's a campaign here to name the new public library after Helen Hughes, because she was on council for many years. And as Ted says, he ran for office once and almost no one voted for him. He was much more successful when he was running Helen's campaigns. Let's look at the fourth book on the list, and this is another one that has a little connection to the show. Back on Canada Day, we did a special show on this book. Tom Hawthorne, local author, and a very, very good one. And he went back and just did a narrative about Expo 67 and just found these fabulous stories. He did a whole hour on the show about these people. The book itself is a really nice read and a reminder of a really, really important year in our country.
And a kind of book you can actually pick up and look at and put down. You know, it's very engaging. And those of us who have a memory of that, I was 3. Yeah. I went to Expo 67. Yeah. I have a vague memory of it,
really?
Or I believe I do. I believe I have a memory of it. You know, the Czech pavilion.
Half your colleagues in the House weren't even born then.
I know.
You've got what, 8 people that are 40 and under?
You see, at one time I was young.
Okay, let's look at the last one on the list, because this is interesting. We both read this book.
Yes.
And I'll say why I liked this.
Right.
This is an amazing piece of reporting by a reporter who went and reported something that people in her city, Los Angeles, had been ignoring and discounting for years, which was the terrifying murder rate in the ghetto in Los Angeles.
Yeah, and people have seen the TV series The Wire, which is quite a prominent series. The last season was about a newsroom and about the pressure and why some stories get covered in some postal codes and some stories don't get covered in other postal codes. In this case, this reporter went in depth in a number of cases that were not high-profile cases, but where people were murdered, and followed both the people in the community, but also, in particular, the cops involved, who determinedly followed the case to conclusion and found the murderers and what that means. And if anyone has had any experience in their lives with unsolved murder, they'll tell you what that means to people, and just following the lives and the determination it took. It's not a story that was told. I think part of the story was the reporter saying, the story was like this mentioned in the newspaper, but it's really a fascinating book if you want to look at violence and crime and how to deal with it and the social impact. It's interesting, but as story, it's also very compelling.
Yeah, I mean, she goes and finds this case, the son of an African-American policeman who was murdered. That's just one of the cases. It's almost like a thriller, even though it's a real-life thing. So very impressive. Adrian, I know you got a stack of
I got a stack of
over
other
there,
books. We're gonna take a few.
We're
going to take a few.
Yeah.
This is a really good book. It's a biography by Tony Petticoat. It's called Hunting for the Northern Character. Tony Petticoat was the Premier of the Yukon. He worked for the BC government. He's an extraordinary writer. He once won, I believe, a 3-day writing contest. But he lived in the north. He married a Dene woman. He has his son is a famous actor, Temu Pennicott. People know Battlestar Galactica. But he's really talking about the North, about Northern politics, about how the North organizes itself. And so there's some of that. There's some of his personal story. and it's really terrific, and he's a terrific writer, terrific guy. Here's a murder thing for people who like murder mysteries. It's called 6-4. It's a bestseller in Japan. A million copies in Japan. It's been translated. First of his books that have been translated. And you'd be interested in this. The protagonist is a police detective, and there's two kidnapping stories, one 14 years apart, and the first happened at the end of a dynasty, which is what the 6-4 is about. And it's truly an interesting detective story. I think people who liked the Stieg Larsson novels, this is vastly better written than those. Oh, wow. I like the Stieg Larsson novels, but they're really good bad books. They're compelling and they're interesting. And you can't put them down. But this is outstanding. It's interesting. It tells you a little bit about Japan and the relationship also between the police and the media in Japan. So it's ideal for you.
I'm going to stop you because
yes,
there's one more thing I want to get to.
Okay.
As a resident of Vancouver Island, Dermot Travis has got a question for you.
Sure.
And I think we need to get this one answered. Here's Dermot.
A rather scathing report came out on the Nanaimo Regional General Hospital. However, there's a belief that some of the threads in that report may apply to other institutions in the health ministry across BC. What do you plan to do to find out, number one? And number two, do you have any plans on how to address it in 2018?
So how do you get a toxic workplace like that?
Well, over time, I think the people working there, the healthcare workers and the nurses and the doctors, felt completely not listened to. There's also an important policy issue. There's something called the iHealth IT system, which is a matter of intense dispute. And in fact, there's another review being done right now by Ernst & Young that I ordered, which is addressing that question as well. So you had management imposing systems without the work done. Part of the problem with IT systems, I should say, and how we deal with, I think, the iHealth thing will be, I think, point the way to how we're going to address this problem. Can we come together to solve problems in this hospital? And that will involve empowering people, empowering the doctors and nurses there, and developing new relationships. The one thing we wanted in the report on the workplace, which was very critical in the workplace, everyone thought they're not going to release the report, they're not going to be truthful about it, they're going to say there are a few problems, but we can deal with them. The report was scathing, and everybody who was involved, all of the players involved, acknowledged the report, acknowledged responsibility. Actually, we're all mostly in the press release that was put out on it, all the different components who had different views. And now we have to start, but like every other problem, unless you acknowledge the problem exists, you're not going to solve it. So we've begun the process, and it's going to take a while. I'm determined to see it get better. Nanaimo Regional General Hospital is a pretty important hospital on Vancouver Island, and we can't allow a situation where people believe independent reviews say it's a toxic workplace to continue. We have to work, and it's a day-to-day thing, and it's not something that I can order as Minister of Health. I can't say don't be toxic. We have to bring the players together and do the hard work to make it better. There's a lot of pressure in hospitals.
We've got about a minute left. Show me the poetry book.
The poetry book. So a fisherman, a guy named Joe Denham.
You have a
called
poet
Windstorm.
in your family.
My wife, Renee Sackar, is a poet. I did not bring one of her books because I thought there might be a conflict of interest.
Yeah, well,
but
that's
she's
fine.
outstanding. But this is a book she's a fisherman, and Joe Denham is a fisherman. And this book, I think, if you're reading poetry and you want a book that brings BC to life, and that kind of world life, he's a working guy, he's an interesting guy, and he's just an amazing poet. I happen, because Renee's a poet, to go to a lot of poetry readings. And so I actually have developed some understanding and knowledge of poetry. I don't say, why doesn't it rhyme anymore, for example. And here's one, I'll just leave this. It's called Empire of the Sun. This was the best play in Vancouver in 2015. It's if you like Robert Lepage, if you've ever seen his work. This is just an outstanding story of the immigrant life. It's actually the text of the play, but it's just fantastic. Tetsuro is an amazing actor. And I'll give one more. The Poet Laureate of Vancouver, Rachel Rose. This, if you're giving a gift, at Christmas.
Okay.
It's called the Dog Lover Unit.
All right.
And it's about dog units.
And so
police
we
dog
say
units.
farewell
It's fantastic.
to
and I
Adrian Dix.
recommend
Thank
people
you
see
very
it.
much.
Thank you.
Appreciate it. No, this is really fun. And the serious stuff was really interesting. Thanks for being on the show. I really appreciate
Anytime.
it.
Thank you very much. Merry Christmas.
Thank you for watching Voice of BC, bringing the legislature, BC politics, and a stack of books into your living room. Good night.
The following is a community access program. While this program does not necessarily reflect the views of Shaw or its employees, Shaw is proud to support local producers and share local voices, ideas, and opinions. To find out more about community